into problems. So we have experience in that too, that it can reliquefy the lymph fluid if it gets into some problem. But it's very hard to say exactly what it did unless you really have the diagnostic and the test and the history before and after in order to really see the changes. Most of the time, the blood test reveals a lot too of what's happening. If you look at the components, what's taking place in the blood and the changes. But to tell you a very simple example, for example, arrhythmia. 1 or 2 injections just wipes it out and restores it. And then again, if you look at the old FDA file, it's in there that adenosine restores arrhythmia. But you don't hear much about it. Now, when a heart attack patient is rushed to the hospital, the first thing they gave him to save his life is adenosine. Adenosine is made from synthetically. It costs $1,000 per milligram, and that puts it $1 million a gram. Now, we're giving the same amount of adenosine, plus we're giving the guanosine and also the phosphates, which, it's much better for the same amount for $12.50 a shot. At that price level, everybody can afford to take it and clean out the blood vessels before you have to call the ambulance. Yes, ma'am. No, oral crystal will not cure cancer. The oral crystal.
Can you repeat the question so we can?
The oral crystal will treat the cancer. Now, the oral crystal rebuilds, restores, cleans out, chelate, rejuvenate, restores cell function, reinforcing immune system, but will not attack diseases. Now, only your immune system can attack diseases. The Chondriana, which is the military, that is the one that you use for all the untreatable diseases, whether it's cancer or AIDS or Epstein-Barr, rheumatic arthritis or lupus. It's very effective against all of them. But it has to be Chondriana, and the Chondriana can be only administered intravenously. And it has to be done by clinics and doctors. And when you get the treatment, you have to stay under clinics or in the doctor's office observation until you get over the immune reaction. I would advise any doctor to let the patients go before they had the immune reaction, because they can get an immune reaction in the car when they're driving, and they're in trouble. So that they should wait until the chill and shake is over.
Dr. Merkel, would it be appropriate for you to comment on, there are a number of people here from the U.S. and they're wondering how they could, is it possible for them to receive injectable material in the U.S. according to the 1988 law?
Well, the FDA, the stand is that, and based on the law, if you read the law, that as an individual you have the right for you to receive your own choice of medicine. Now, if you want to get either large crystal or Chondriana into the United States for your own personal use, not for resale, and complying with the 1988 law that requires that you have a doctor who is going to administer it to you, then you can legally bring it into the country for your own personal use, 90-day supply. But you must have a doctor. You must write the letter, otherwise they won't ship you if you don't write the letter. And the doctors have to put a letter into the file to protect himself that it was your wish to bring it in and use it. Yes, ma'am?
How often are these injections, or how far apart are they?
That depends on the amount of disease, and it depending on also on the patient's, the doctor's decision. Usually they do it once or twice a week. They start out with 0.1 or 0.2 cc the first time to find out the level of immune reaction what a person has, because that is commensurate with the amount of disease. And by giving a very low dosage rate, they can time the immune reaction rate, the chill and shake. If the chill and shake is lasting only 20 minutes, they know they have to increase the dosage rate to half a cc. And then that's the dosage rate. They give that half a cc once a week, or maybe twice a week. So most of the time when they give 3/10 or 4/10, they do it twice a week. But if you give it too often, too fast, you're releasing the toxins too fast, like at the beginning when the clinics were doing the clinical test, and they did not listen, but they've been anxious to get the patients well. They were giving 1.5 cc every day. And in 2 weeks, the person got into problem with the liver because the liver couldn't handle it. So they backed off and let the liver, recoup and resume the treatment at a much lower dosage rate. It's not recommended to overdo it. The lower rate gets even better result than try to put in too much too fast.
What's the difference between the suppleness of the gentleman that introduced you, which said that the product Nutriana and the other product is not the same as the product that you're producing?
Well, I don't know anything about Nutriana. It's not my product. My product is made from human genetic material. It's called it's under that trade name, and they are little humanoids. They are ancestors made from our made of our DNA molecules, or rather our genetic material, and they are 100 micron in size.
Is there anyone here that's representing the Nutriana product, like the gentleman that introduced you, that can tell us the difference?
Well, he was telling at the beginning of this talk that the Nutriana has nothing to do with mitochondriana. At the beginning of the talk, so I think there's not much more to discuss about it. That it's not the same product, so I don't know their product, and the Chondriana cannot be distributed by anyone other than clinics or doctors. That's a product which can only get into doctors' offices and clinics and not to individuals. Yes, ma'am.
What is the shelf life for the life crystal?
The life crystal has an infinite shelf life. The oral one, once you open it up, it's recommended putting to the refrigerator just to play it safe, but it's not really necessary. But we recommend that people do that because you leave the cap off and the air is dirty and the air has yeast get in there and you may start fermentation. We took the water content off to prevent fermentation, and it has no preservative, but the ATP and GTP itself is on the acidic side. It's a good preservative by itself. The product has all been tested in Colorado by the FDA for bugs, and it was clean. There was no bugs in there because we don't have preservative.
Dr. Merkel, you said that we that are in the U.S. need to write to someone. Could you tell us who we need to write to so we can get the life crystals and the Chondriana into?
No, not in the U.S. If you call the telephone number of our office, they give you the list of doctors or names in other countries. We do not sell we do not manufacture or sell.
Who do we write that letter to? We don't know.
To get the Chondriana?
Yes.
Well, that information is given out from our office to send them to Mexico or Europe or Canada.
What's that number?
Okay. Could we have the number then that we need?
No, you have to call 915 area code 877-4520. But that we cannot give you any other information. Just give you a telephone number where you call, because we are not allowed to promote, manufacture, distribute Chondriana in the United States.
Okay.
Or just a minute, maybe I can give you directly numbers. Do you have Dr. Villapando's number? I have 011 5216 access code 152001. Okay, that's in Mexico. And you can write there or phone there directly, and that's one of the suppliers from Mexico.
Could you repeat that number again for some of us?
152001. And the access code is 0115216.
Thank you.
Now, there's another number in Toronto, Canada. Man, there is another number in Toronto, Canada. 416-487-0882. And that's Dr. Dabgan.
Thank you.
Welcome. Debgan, Robbie. 416-487-0882. Yes, sir.
Dr. Merkel, I have some injectable material. I don't have a doctor yet. And I have lupus. I'm also taking prednisone. If I take the injectable material, I can't stop my prednisone. Can I take it at the same time?
I'm really not allowed to give you advice on it. You have to see your doctor.
Okay.
You know, I really can't say because I don't know the drug itself.
Mm-hmm. All right, well, thank you.
You're welcome.
And also, the other question I have is, how many weeks do you stay on it, or is it just dependent on the testing that your own doctor does?
First of all, you know, it's depending what type of lupus you have. You have type A, B, C, or D. They're all different. You know, like the type A is attacking joints, and type B and C attacking organs, and type D is attacking brains. It's depending on what type you have.
God, I hope it's A.
Well, and each one takes different amount of treatment, but our experience, we have a clinic who is working, specializes in lupus in Dubai, in the Middle East,
Oh.
and they report to us that some only takes 3-4 injections, other ones takes 5-6. The general recommended by the clinics to take the whole tube. Again, it depending what type of lupus. Now, rheumatoid arthritis is a lupus disease too, and Candriana is also very effective against that.
Thank you very
You're
much.
welcome.
Dr. Merkel, you spoke about chemotherapy reducing the effectiveness of the Candriana treatment. Can you tell me whether there's a time limit? If the body has had chemotherapy, say, a year previously, does it have more chance of accepting the Candriana treatment?
It's not so much that it's affecting the Candriana treatment. The chemotherapy does a lot of damage to the immune system, the bone marrow. This is why they do bone marrow transplant after chemotherapy. And the stem cell production, which is the germinal centers, which is really destroyed. But chemotherapy not only attacking your bone marrow, but also attacking all your other organs and your tissues. It's very well established, very well known. Now, the reason that the remission rate is lower, not because the Candriana is affected by chemotherapy, but because the damage has been done to the organ and the body to handle toxins, and the liver and the kidney to function properly, and restoring the immune system. If there is no stem cell production in bone marrow to go to the other lymph organs to form or energy already activate the B lymphocytes and the T cells, then you're left there without an immune system. That's why if cancer comes back after chemotherapy, you are there hanging without an immune system. The Candriana can rebuild the immune system. It takes about 3.5 months. The problem is that most of these patients don't have 3.5 months. They may have 3 weeks or 4 weeks, and you never get them to the point that they can take the Candriana treatment. Also, they're very anemic. I just mentioned the Japanese Hiroshima case that they all lost their blood platelets. And you wonder, you know, when all this radiation and chemotherapy people get it, and their blood platelet counts goes to hell. And you cannot use Kandriana on those people because you have a very strong immune reaction, and they're prone to get a stroke without a strong reaction. So you just instigate that stroke to come along if somebody has a low blood platelet. People like that have to take a blood transfusion first and then go to the Kandriana treatment, so that in order to avoid to getting a stroke. And that's why the clinic's afraid and they don't want to use Kandriana when people are in such a critical stage. They will try to nurse back the organs and restore the system so that people can accept the Kandriana. Now, as you said, if you got chemotherapy a year before, somebody, apparently, you know, there's a lot of damage has been turned around and repaired.
Yes.
In that case, those are the one who comes out from, according to the statistic, those are the one who comes out and the Kandriana is successful after chemotherapy treatment. But most of the one cannot take the Kandriana because the conditions they are because of the treatment.
And you're not differentiating between different types of chemotherapy, 5FU compared to a different type of chemical?
Of course, they're all different. They all have work different, and they all producing different kinds of damage depending on what it is. 5U4 is also very bad.
Okay. And has any work been done with the Kandriana in primary biliary sclerosis?
Primary what?
Biliary sclerosis?
I'm not familiar with it.
Okay, so how would we access information about that?
Well, you will have to talk to the clinics or the doctors. So
And
the only area I know when they're sending me the specific reports and specific cases, was you're collecting all the clinical data.
okay.
And where they try to go after the main untreatable diseases, which is necessary to prove it for approval.
All right.
So they don't go after every disease. But if some comes along, you know, they will not turn the patients down. But I don't have anything on that particular one in my file.
Thank you.
You're welcome.
My doctor has said that he would be willing to inject me with this Kandriana if he has information. Is that possible for him to do it, a doctor in the Lower Mainland, or do I have to go to a clinic that's already established and using
No,
it?
your doctor can do it. Your doctor should get the protocol, which is supplied by the suppliers. And there's also a clinical data book floating out there somewhere, and that available, so he can go through and see what other doctors have done in different parts of the world.
Mm-hmm.
It's describing the treatment. I would be very happy to talk to him too, based on my experience. And based on the protocol, he could treat you. And any doctor knows the basic function of the body and the organs, so they know what to do.
Okay, and we would access you then through your state's number, or how do we?
No, you access directly to the number I was just giving to Mexico, to Dr. Villapando or Dr. Devgan in Toronto.
So that's how I access you, through those numbers. Thank you.
Yes, correct. Thank you.
I know a lot of people are trying to get this information of accessibility and so on, and I respect that. And I don't want to take too much time talking about the basics, but when you started, or I've seen your video, which show what happens in the life of the cells at a very, very high magnification. And my burning question is, how does your work overlap or add to the work of such other researchers that work with dark field microscopes, notably Dr. Gaston Maisons here in Canada, who has isolated what he called somatids, and which are presented as being, you know, very simple, and like in a simpler form, at least in a popular form, described in a book by Christopher Bird, a popularized way of presenting these.
Familiar with it, yes.
Yes, and a lot of I bet that a lot of people here in this audience have become to a small degree educated in, you know, through that book. So, are you if you're familiar with Gaston
Yes, I am.
Mason's discovery, then how does your discovery overlap?
I also, that doesn't overlap at all. I also replicated his somatids. And remember, some somatids, a submicron organism. A Chondriana is 100 micron. The Chondriana is ancestors or precursors of human beings. Some of it has not been made by human genetic material. It may be made by human genetic material because it lives in the body, but not like the way Chondriana is made, and they're not related at all. If you go into the bloodstream, or even if you go inside the cell, there are as many life forms and as many colloidal life forms than suns and stars in the whole universe. There's so many of them. Now, his contribution to the medical science of biochemistry, that he discovered that anybody who has cancer, the somatids in their blood go through the bacterial cycle, and I verified that for him because I reran his process. I replicated his process with the somatids. And the only difference is that what I did, when the somatids get into the ASCII cycle and they produce spores, I took some of these spores and put it together with the stem cells. And when these stem cells gets into, these spores gets into a stem cells, they disrupt the genetic process. It blows up like a balloon, and you will see it on my yellow book, and out comes 6 malignant cancer cells. Wow. So the spores of the somatids actually can cause cancer. Now, this is why what he discovered, that people who have cancer, they have somatids in the bacterial cycle, and he deserves all the credit for that. But that gives you another angle to look at, because the cancer epidemic is on top of us. And in this decade, one out of every third person in this room is going to have cancer in this decade. Now, there must be many reasons for it. Cancer can be caused by many ways. Radiation disrupting the DNA chain, so the DNA replicates itself faster, and the cell will reproduce much faster, proliferate much faster. So the cancer cells really premature stem cells, and you can cause the same breakage of the genetic material, or damage to genetic material by chemicals. But spores, if the spores gets into, which I proved, that spores gets into stem cells, can differentiate into cancer cells. And these spores not necessarily coming from the ASCII in the somatid cycle, but rather penicillin, antibiotics, and all the drugs that manufacture with fungal or yeast processes. And they all contaminated with spores. So that the sources of the cancer can come into from many different directions, because the environmental condition we live and the toxic food, water, and chemicals and medicine we are producing.
Further, I'm wondering, there's something that Gaston Mason's is doing right, it appears. He's injecting, I believe, some camphor tree derivative right into the lymph nodes of his patients, and claims a very high recovery rate in 750 out of 1,000 cancer cases. Is he inadvertently affecting the presence of life crystals or of
No, I don't think so.
What's happening there then?
Well, I don't know how his system works. He developed his system. And all I can tell you that I gave a lecture in London, the Royal Academy of Medicine in 1968. And at the same time, there was a Dillington Tea Company there promoting the camphor to cure cancer. So a lot of work has been done in England already then about the camphor. Now, how his system is working, is the one to know because that's his product, but I'm not familiar how he some of it's working.
Thank you.
You're welcome.
Hi, do you know if they've had any success at all with Lou Gehrig's disease, and if so, which treatment?
The only report I can report you is one. According to Francisco Contreras, he treated one Lou Gehrig with Condriana treatment, and it was successful. I have no report on it, and that's according to his saying, but that's all I know. Now, recently, a couple of cases came up, and I believe that the clinics who are doing the clinical studies, they will include a couple of Lou Gehrig to see how the Condriana is working, hopefully documenting it.
And how would I find out about the documentation?
Well, as soon as we have it, then we will disclose it. It's a very recent, we don't have anything going on right now, but we're working on that.
Well, but I mean, how would I get this piece of paper that has it on?
Well, we're upgrading our clinical data book every 30 or 60 days, and we disclose all the clinical data which we're receiving in writing from the various clinics on the world. And it's available. If people either get our clinical data book or call in periodically, then we can tell.
Thank you very much.
You're welcome.
Yes, Dr. Merkel, I would
Yes,
be
ma'am.
interested in your understanding of the disease process, multiple sclerosis, and how light crystals can help, and what the protocol for administration would be.
Yes. Now, well, again, we have to differentiate between light crystal and Condriana. Multiple sclerosis is a disease, and light crystal is not going to put the disease into remission. The first group of people have been treated with Condriana about 2.5 years ago with multiple sclerosis. Out of those, 2 of them got out of the wheelchair, and one of them we keep close contact. He was in wheelchair for 14 years. The third one from Colorado, I believe, didn't have any use of her arm. Just going through one treatment, she was able to comb her hair and start using her arm. Recently, we have Dr. Sanchez Carrillo with the same area code I just gave out before, 0115216. 1606. His telephone number in Juarez, Mexico. Dr. Carrillo. Now, he treated one 27-year-old young man in Dallas, Texas. He threw away his canes, he resumed normal life, he's driving car, and was very successful. That's the latest one. This happened just recently.
Thank you.
I'm sorry.
You're welcome.
Are you able to venture an opinion as to the process itself of the disease and the cause?
Well, I don't really know the process of the disease. I did a lot of culturing about 3 years ago on multiple sclerosis, and it's a crystal. The way the disease, whatever the disease is, it grows like a crystal, and then the crystal producing a lot of spores. They branch out, and I did about 40 cases, and in every case, the same type of crystal, like a snowflake. It started out 120 degrees apart, and it's branched out really, very beautiful, the way like dendrites, the way it was spreading out, and then just turning into branches and producing a lot of spores. And the only tie-in which I had to multiple sclerosis correlating all 40 cases had exactly the same thing, and in no other culture I have ever seen that. It's only specifically multiple sclerosis. So something has to do with it, and I have that on videotape. It's about 15 minutes take to show it. what it is and how it spreads in vitro. I used to take the blood from people with different